Hello, am I audible? Good afternoon, students.
Good afternoon, sir.
Yeah, it's a semester 3 class. Huh?
Yes, sir. Semester 3 only.
Yeah. So I think they are only 14-15 students have joined. Should we wait or should we start the class?
Wait for 2-3 minutes because then we'll be late for all the classes, huh, sir?
Okay, okay. Okay, no problem. We will begin with the class. Yeah, we will offer our respectful gratitude to Khemka sir and all the ASPU team. So this is a third semester PCM. It's a 5th class, and last time I think Ravindra sir has taken the class, and in that I think may I know all of you are having this treatise 3 part 3 book treatise 3.
Yes, sir. Namaste, sir.
Yes, sir. Yes.
Yes, namaste. Yes, so we will begin our class from the page number 19. Treatise 3, page number 19. I think you must be knowing all the Dr. Voll's principles and all the fundamentals of electro acupuncture. And they have begun with the first vessel, that is lymph vessel, LY meridian. Correct? Do you remember what he took last time? Lymph are of 2 types, superficial lymph and the deep lymph. Correct? Or anybody wants to correct me? Actually, Ravindra sir spoke with me yesterday only, and he told me up to the lymph, 2 types of lymph. There means I don't know exactly. And anybody know from your side?
So he started with the lymph and he was talking about the lymph nodes from the ear lymph.
Yeah.
And after that,
2 types of lymph. Functions of the lymph. I think functions of the lymph are over. No?
yes, that is also.
Correct.
And then he started with the lymph points, I think. So
okay, points he started. Okay. He started the point of the lymph vessel.
Yeah, but sir, thoda revision hoga to chalega.
Yeah, no problem. So you might be knowing all the. Basically, you have to know the nomenclature of the points. Nomenclature of the points, which are mentioned on the page number 9, I think. The different points. CMP. What is meant by CMP? It's a control measurement point. Then RP, reference point. Then SMP, summation measurement point. Then partial summation measurement point. Then measurement point. Serous membrane coating point. Then autonomic innervation point and lymph drainage point. That is the central theme of this Dr. Voll's electro acupuncture. So you have to know these points. Always remember these 8-9 types of the points names. Then, because each and every meridian, we will be seeing that which point has this name, this according to these 8 names, like that. So first we will begin with the lymph vessel meridian, LY meridian. It's a point-wise locations and indications. Which point is located where on the hand or the particular area of the body, and what it is for, used for, like that. So first, uh, you know the diagram, the picture on 21 number page. They have given there the one diagram where what the course of the meridian exactly they have plotted there. So if not, then I can share, no problem. All of you having this book, no? Treatise 3.
Sir.
Okay, then you can see on page number 21 is mentioned there. So we will go one by one, locations and indications of points. So NY1, see where it is. It is the outer side, that is towards the radial side. So on this side, if I am, suppose this is my left hand, and towards the outer side of the thumb, there is the beginning of the LY1 meridian. Now you have to remember one basic theme of remembering all the locations of the points in this Dr. Voll. That is, you know, in the thumb there are 2 digits, these phalanges. First number 1 phalange and the second phalange, and there is one interphalangeal joint. Then that phalanges are connected to the metacarpals, metacarpophalangeal joint, and then after metacarpal there are the this radius and ulna, radius towards the this side and ulna towards this side, like that. So each and every bony structure, even phalange, one first phalange and second phalange is carpals. So these are having curvatures, shape, the bony curvatures are there. Means in the middle side it is concave, and on the both side it's a little bit convex, like that. So first point is located in the concave side, this LY1, beginning with the concave side, then convex, the corner of the convex side. Second, LY1 by 1-1. That is the first, second point. See, first point, LY1. Yeah, correct. Excellent. Yes. You can feel also. You can feel while touching that bone, just apply firm pressure. You can feel that bony structure over there also, like that. So this is the point. Yes, you have exactly drawn here. Almost it is at the center of this. Yeah, correct. The course. Center of the nail. The whole nail you can see, and the center of the nail. That is the location, exact location. See this. I have plotted this. This is LY1. Okay. Now, what is the use of this point? This is a measurement point for the palatine tonsil. There are so many tonsils are there. 5 types of tonsils are there in the throat. So I think I will not repeat these, what is mean by tonsil and how they are located, where they are located, because in BHB almost all syllabus is covered by that particular teacher. And you have to know this lymph, means all these tonsils, palatine tonsil, tubal tonsil, pharyngeal tonsil, lingual tonsil, and laryngeal tonsil. All the 5 types of the tonsils are situated there only. So this is the measurement point for palatine tonsil specifically. Now, they have mentioned some specific uses of that also. Peri and retrotonsillar area. Then this area's lymph drainage. This is the one point, LY1, specifically used to treat, to drain all the structures, these palatine tonsils specifically, cranial, then the cranial profound deep cervical lymph nodes of the neck. They are also draining with the help of this point. Means any infection on this tonsillitis or any infection to this palatine tonsil specifically, they can be treated by applying this LY1 point. Okay. Okay, then we will go to the next point, LY1-1. Where is it located? It is located just near to that convex part, upper side. Okay, that is the LY1-1. What is the use? This is the reference point of lymph drainage of ear. Any problem, any infection, anything related to ear, So we have to apply this point, LY1-1. Any problem related to ear infection, hearing disturbances, anything, we have to use this functional as well as structural disease elements of the ear. We can use this LY1-1 because this is a reference point of lymph drainage. Okay. This includes the auricular lymph node down to the neck, then outer, middle, and inner auricular lymph node. All the lymph nodes are drained through this one point application. That specifically they have mentioned which points means this along with this LY1-1, which point should be used. So this is a middle ear, L1-1, LY1A, triple warmer 3 and triple warmer 17. Now in the treatise 4, you will be learning all these meridians according to Dr. Voll's Electro Acupuncture. All these meridians which we have already seen in the TCM, like all the 12 meridians principle, all 14 meridians. All these are learned through the Dr. Voll's point of view, Electro Acupuncture. Okay. So in that they have mentioned triple warmer 3 and triple warmer 17 can also be used for treatment of middle ear also. Okay. So and like that only external ear and internal ear is also mentioned. Now we will see the next point. If anybody is having any difficulty, you can ask me, no problem. Okay. Can you please mute your
That's it. That's it.
My one dash. This is the reference point for 5 types of tonsils. Again, 5 types of tonsils have come here. Now they have mentioned that all the 5 types of tonsils and their related treatment points. Okay. So pattern tonsil at the roof of the mouth. Then for that, these are the points we have to use. You can see the point and you can see in the diagram, the location is exactly given. You have to remember the points and its locations. And for what the use are given in the book also. So tubal tonsil, then pharyngeal tonsil, related problem is there then. Lingual tonsil and laryngeal tonsil. For that, LY1-2 is compulsory point. And along with that, LY1A, some is having LY1, some is having ST3A like that, and LI7 like that. So that different points from the treatise 4, we will see it when we will learn that treatise 4. Okay. So we will go to page number 22, LY1A. Now we can see the location of LY1A. That is the second metacarpal at the convex side. This one here. You can feel that bone, the bent, the concave part and the convex part again towards the metacarpal. This is the location, exact location of the this second point, LY2. That is LY1A. Okay. So LY1A is measurement point for tubal tonsil again. Again, tonsils are given there. So it is spatial note. In spatial note, they have mentioned the different infection, types of infection and all that. When the infection spreads from the throat to ear through tubal tonsil, hence for pus in the internal ear happens, and then pus secretes because of a rupture of the tympanum, treat LY1A along with the ear points, LY1-1, like that. And they have mentioned one specific note you can observe there. When patient is not having his hand, if amputated hand is there, amputated thumb is there, anything, in any case, you can use LI18 in such cases to treat their tubal tonsils. LI18. Okay, this large intestine 18 number point. It comes here only, 18, 19 somewhere on the face. We will see that the locations while we will see about the treatise 4. Now the next point, if anybody is having any doubt, you can ask, no problem. Huh? In picture, every locations is completely means very nicely given. The locations of the points and the uses are given in the book theory part. Now LY2. This is the reference point for limb drainage of upper and lower teeth and jaw. Now you have to remember there are 32 teeth in our jaw, lower 16, upper 16. In upper 16, we have to measure this front two teeth are there, front two. Now divide that from the center on right side and on the left side. Okay, on right side measure this as a first teeth. 1, 2, 3, 4. 1, 2, 3, 4. On the left side also 1, 2, 3, 4. This 1, 2, 3, 4. These are the 1 to 4 upper odonton. They have mentioned here. SMP of odonton number 1 to 4 upper. Upper 1 to 4 means these 4 right side and 4 left side. That means 8 teeth. Any infection to this front side upper 1, 2, 3, 4 on both sides, right and left. Okay, these 4 teeth means total 8 in number. Any infection, any pain, anything happens with this 4 and 4, 8 teeth, the point should be applied LY2. This is a limb drainage point. So your infection will subside and ultimately a cure will happen. The pain will subside also, like that. Now, number in that way only upper side, in that way only lower side. Then again lower 2 teeth, front 2 teeth. You have to see, divide it into the from the center, right 1, 2, 3, 4, left side 1, 2, 3, 4. Again this lower 1 to 4 odonton CV24 number point. Along with this LY2 and CV24. Then upper GB25 and LY2. Again 5, 6, 7, 8. After this 4 number teeth on right and left both side. 5, 6, 7, 8 on the right side, on the left side. Upper odonton 5 to 8. That is ST7 along with LY2. You have to use these 2 points to treat this any infection of this 5, 6, 7, 8 number teeth upper side. And lower 5 to 8 ST8. ST8 along with LY2. Have you understood this? Okay, we'll go ahead. Now LY2A. This is the reference point for limb drainage of eye. If any infection, any complaint of eye, visual disturbances, any problem of eye, you can use this LY2A. LY2A. Where it is located? LY2A. It is at the center, almost center. This. Where is the exact location of which point? Can you tell? Anybody tell me? This is lung meridian correspondence point. Which corresponds here? LY2A. Anybody from all of you? Lungs meridians, which point is corresponding to this LY2A? Have you learnt about the lung meridian? On the body, have you learnt lung meridian? It's a 3rd semester is going on, I think. No? So you must be knowing the on the body which means lung meridian, how it goes. You have to, yes, correct. Pallavi M, correct. This is LU10, perfect. So it is almost corresponding to this LY2A, LU10 point. Now we will go to LY3. This is the reference point for limb drainage of nose and paranasal sinuses. If any complaint regarding nose and paranasal sinuses, means cold, coryza, cough, or sinusitis, any complaint, any diseases, we have to use this LY3 point. LY3. Where is this LY3? This is the control measurement point again, CMP. This is at the base, almost base. Means every bone is having concave part, that is the center, and both side convex parts, both upper and lower end. Yes, correct. Yes. So this is LY3. Yes, yes. Yeah, you can tell me, Kiran Ladha, madam. Yes, you can show, no problem. Okay, you can unmute it. Your voice is not coming. Okay, it's not available. Unmute. Okay, we will see whatever question is there in the last 10 minutes. We will have discussion on that. Okay. So this is a nose and paranasal sinuses related point. It is considered to be the reference point for pathological process in the paranasal cavities and the ethmoid cells. Okay, sinuses are of 5 types. Again, like the tonsils, there are 5 types of sinuses are there. You must have learned this in the BHB. There are 5 types of these: frontal sinuses, then maxillary sinuses, phaenoid sinuses, ethmoid sinuses, and cavernous sinuses. 5 types of sinuses are there. Sinuses means nothing but the cavities in the bony portions of the face, the skull part, but this is the face in front. All the sinuses are there on the face only, face in front side. So if there are specifically different points are mentioned to treat the difference along different sinuses along with the LY3. So in that frontal sinuses, see, this is the frontal sinuses. Just below the eyes, there are frontal sinuses. So to treat any infection or sinusitis problem or any cold coryza type of problems, we have to use this LY3 point along with that UV2, LY13 and 14. We will see in the next pages, that is LY13 and 14. Okay. So this LY3 is important point for limb drainage of nose and paranasal sinuses. So you can read it out for maxillary sinuses. Any problem, then you have to know where is the problem exactly located. You have to come to the diagnosis exactly. After after taking the history of a patient, you have to come to the proper diagnosis, whether it is a frontal sinuses, maxillary or sphenoid sinuses or ethmoid sinuses. If patient is complaining about the headache, then it's ethmoid sinuses, like that. Maxillary sinuses, cavernous sinuses, like that. And the different description is there. See, sinus of the middle ear. Maxillary sinus is the sinus of middle ear. Sphenoid sinus is the cavity from sphenoid going to nose. Okay, then ethmoid cells are sinus for the above of inner brow of the eyes. Inner brow, yes, correct, inside. Just near to the glabella. This is the center point of our face. The glabella, just near to that, means inner eyebrows, inside the eyebrow. Not outer side of the eyebrows, it's the inner side. Then this is ethmoid cells and the cavernous sinus from the sphenoid fissure to the petrous bone sinuses. These are the, you can just search out, and if you want to see the detailed structures of each sinuses, you just go on the Google and you can see all videos, all diagrams, different pictures. You can see that in detail which structure is located where on the face, which sinuses and everything. Because that's not our part. We have to learn this, which LY3 point according to Dr. Voll is important for the drainage or the infection of all the nose and paranasal sinuses related problems. That's our syllabus only. So in detail, if you want, you can go to Google and search out any anatomical and anatomical structure in the body. You can see that detail here. Okay, in the last few lines they have mentioned cerebrospinal fluid drains in a cavernous sinus. Hence, for the increased pressure of cerebrospinal fluid, treat this cavernous sinus. Means some patients are having the problem of the CSF, increased pressure of CSF. That time also we can use this LY3 point along with this UB1 and LY13. Okay. So we will go to the next page. This is 24 number, LY4. LY4 number point. Where is LY4? You can see in the diagram. That is located in the, you must be knowing that 6 bones, that is the structure of the 6 bones in the below the palm, in the wrist joint per se. Yeah, lunate, capate, hamate, these are the 8 types of bones are there. So yes, correct. So in that there is one just at the base of the thumb. Just at the base of the thumb, you will feel that structure, bony structure, where you will get that concave part of that bone also. That is the exact location of that point. Okay, LY 4. For what it is useful? It is the lymph node drainage point of the mediastinum and lung. Any problem of the lung, whether it is pneumonia, bronchitis, chronic pulmonary obstructive diseases, or anything, even productive cough, cold cough, any problem related to mediastinum. Mediastinum is the part in between both the lungs. Okay. And this is also a measurement point for the pulmonary vessels, then measurement point for the lymph node of pulmonary and pleura, then measurement point for pulmonary bronchotrachea lymph node, that is lymph node of bronchi and trachea. Means all the structures between the lungs and lungs per se, and mediastinum. See, that is given there. What is meant by mediastinum? Mediastinal compartment between the lungs containing the heart, major blood vessels, trachea, esophagus, and thoracic duct. Place between both the lungs is called as the mediastinum. Okay, so you might be knowing this respiratory system, all the structure. The pleura is the covering of the lungs and all that. Everything, lungs and its coverings, the mediastinum, everything, any disease of any element from this lung cavity, chest cavity. So that is the drainage point is LY4. Now LY4A, you can see the location LY4A. Now it is the corner of which bone? Which is this bone? Can anybody tell? LY4A, location of the LY4A, the corner of that bone. LY4A and LY4B, they are very nearly seated with each other. Which are those? What is the name of that bone? Correct. Radius. Radial side or radius. So on the corner of that bone, you must be feeling here, which is very prominent. You can just move the hand like this. Just press on this point. You will feel that point here. Exactly where the watch is there, like that. So that is the prominence of that bone. On that prominence only, we have to place this point. Okay. That is the radius, the tip of the radius. So on that is LY4A, which is a specific point for esophagus. Any complaint of esophagus. So we have to use this LY4A, and just below to that is LY4B, which is the lymph drainage of larynx and hypopharynx. Larynx and pharynx means any this food pipe and wind pipe. Any complaint related to that, we have to use this LY4B. So can anybody tell me the treatment method? Suppose anybody is having any infection of these structures and we are using this LY lymph meridians points. So what to do in the treatment part? Whether we have to sedate or whether we have to tonify this point? Can anybody tell? Correct. Very good. We have to sedate these points because infection is the high ang condition, yang. It's a yang excess. So we have to use the sedation. Okay, we will go to the next point, that is LY5. LY5. This is partial summation measurement point for lymph vessels of the heart and pericardium. Pericardium is the covering of the heart. It is an important point for the treatment of the heart and pericardium. This point is connected with the H5 directly. See, they have mentioned that this point is internally connected to the H5. Where is H5 located? Can anybody show me? It's on the radial side or ulnar side? Correct, ulnar side. No, it's ulnar side. H meridian means heart. Yeah, correct. This is not the this part, but inside. From the inside, it goes like this, and this where we will feel some groove. That is H7, and below the H7, half kun below H6, below half kun, that is H5. So internally, this H5 internally connected to this LY5 point. LY5 and H5, these are internally connected. So a special note is given. A treatment on this point stimulates and reinstates the lymphatic process of the heart and pericardium, which is blocked by toxins. This will help to eliminate the blockages in cardiac cannula and coronary plexuses also. So any problem related to heart and pericardium, even blockages, that can be removed by applying this LY5 point. Where is the location of LY5? In the next diagram on page number 23, you can see that. So it's almost the same distance. Correct, correct. Yes, very good. LY5 and LY6. And LY6, you can feel even bony structure here. The radius bone is having little concavity and convexity again. So that is on the straight part of the radius bone. So it's almost 1.5. So which point is correlates to this LY5 in the lung meridian? Which point is almost correlated? Lung meridian. Correct, correct. Pallavi madam, correct. Lung. Sorry, this Nandini madam is correct. Lung 7. Lung 7 point is almost 1.5 kun towards this side. Okay, LY5. Now LY6. LY6 is a measurement point for lymph vessels of the upper extremity. Any infection from the axilla to anywhere in the upper extremity. Any infection in the upper extremities or any problem related to upper extremity, the lymph drainage point is LY6. They have mentioned some part, special note. It is an important point for the treatment of limb congestion of arms. Okay. So limb congestion in arms is being observed in the case of a breast removal. In these cases, please treat this point also. Breast removal in some cancerous cases or something like. In ladies, it happens sometimes. Now it is the if there is breast cancer or fibroid on breast and hand pain also starts as well, then treatment on this point relieves the pain and diseases of the breast can also be cured. So anything lump or any kind of disease in the breast can be treated by this LY6 upper extremity. It is related to breast also, upper extremity. Then LY7. We can see in the diagram LY7 on page number 26. It is mentioned LY7 and LY7A. These are now you can see the differences of almost. You might be knowing the kun measurements. How much kun is the hand from the wrist to the elbow? Can anybody tell me? Do you remember or not? No. It's not 7. It's 9 kun. So you can see almost from point number this LY. We have seen this first. LY for A and LY for B was on the bony structure prominence. Then from there up to LY5, LY6, then LY7, LY7A, LY8, LY8B, LY9. These all points are there in this 9 kun measurement on the hand. Okay, they have mentioned here LY7 number point specifically on right hand and on left hand. So on left, measurement point for intestinal lymphatic trunk, any intestinal disorders, and LY right side is a measurement point for mesenteric lymph nodes. Now mesenteric joints organs to the body. Mesentery is just like a fascia. It's like a peritoneum or like a fascia which connects to the joints to the organs. That is mesentery. So mesenteric lymph nodes. It is a point of a lymphatic gland of membrane for captivating intestines. Mesentery is a membrane in the cavity of the abdomen which sustains and encompasses the intestine. You might be knowing when you will learn BHB in detail, mesentery, structure of mesentery. So lymphatic drainage of mesentery also, that is, we have to use this LY7 number. Okay. Now LY7A, you can see the LY7A, this is measurement point for celiac lymphatic trunk. Okay, celiac is relating to the abdominal cavity and celiac is the part between the chest and navel. Celiac lymph node, which is situated at the diaphragm part of the chest and abdomen, where they are divided by the diaphragm. So, and the that diaphragm part, there is celiac lymphatic trunk is there. So when you will learn about lymph vessels in the BHB syllabus, that time you will come to know this celiac lymph node is there situated. So to train that celiac lymph node, this measurement point of lymph vessel 7A is very useful. So next is LY8. On the left side again, this is measurement point for lymphatic drainage of the left side of the intestine. Specific, if we know the infection is on the left side of the intestines, we have to use this. Which part is there on the intestines on the left side? For example, tell me about the large intestine or small intestines. Which part? 3 parts of the small intestines. Yeah, no, it's not transverse colon, some part, and the descending colon of the large intestine. And small intestines, which part are there? Which are connected to the stomach. First part is duodenum. Yeah, sigmoid is on the left, correct. Sigmoid colon, that is also on the left. And small intestines, which part? Duodenum, jejunum, and ileum. So duodenum and jejunum, especially on the left side. Now it is related to mesoiliac. All the nodes are there. When you will learn about the that lymphatic vessel per se in the anatomically, they have so many branches. That's the celiac branch, mesocolic branch, mesosigmoid branch. Different branches are there according to different structures, anatomical structures of the intestines. Okay, LY8 on the right side. On the right hand, if you will apply, you will have to apply LY8. It is used for measurement point for lymphatic drainage of intestinal roots. And it connects large intestines to center. Okay, then LY9, again it is almost the last part on the arm, that is on the radius, last point, LY9. LY9 is MP measurement point for lymphatic drainage of endocrine glands, namely thyroid and thymus. If any problem related to thyroid, nowadays it's a very common problem in everybody is there because it's a digestive disorder, no? And our lifestyle is completely disturbed. That's why this thyroid is very common nowadays. So in thyroid and thymus gland is here and thyroid is here. So for any complaint of thyroid and thymus gland, we have to use this LY9. It's important point for the boil, lump, irritation, burning sensation, pus, etc. of the thyroid and thymus. Any infection of the thyroid and thymus. Now we will come to page number 28. Now we'll see the first point on the, which bone is this now? LY9A. LY9A. Humerus or femur. Correct. Humerus. So on the just concave, that the angle of that humerus, head of the humerus, on that angle this located LY9A. And what is the use? This is the measurement point for lymphatic net of aorta and aortic lymph nodes. Aorta, any infection of aorta. What is the what is meant by aorta? It is related to which system? According to BHB? Yeah, circulatory system, cardiac system, heart, yes. Now LY10, next point, LY10. Where is next? It is the upper head, just angle of the upper head of the humerus. There it is location LY10. This is the measurement point for lumbar lymph nodes and lumbar lymphatic trunk. Okay, even the treatment for treatment of fibroids in axilla. If any fibroids are there in the axillary region and anything related to lumbar lymphatic trunk, lymphatic vessels is having lymphatic trunk at the lumbar part also. So to drain that, we have to use this LY10. Okay, that is very deep types of diseases inside, but you just know by lumbar. Where is the lumbar 1 to 5 vertebrae? Do you have covered this skeletal system, bone skeletal system? So lumbar is the almost a second last. The sacrum, coccyx are there, and above that lumbar. After thoracic 12, it's lumbar 1, lumbar 2, lumbar 3, lumbar 4, and lumbar 5. So to drain those areas, this is LY10A. Now we will go to the next LY10B. Again, it is located LY10A and 10B. These are located on the clavicle. You know this clavicle, on the first angle of this clavicle and the middle part of the clavicle. This is clavicle located here. So on this first, the outer head of the clavicle, that is, there is one angle. There is this LY10A and LY10B is the center part of the clavicle. Now again, left and right they have divided LY10B. Measurement point for cervical portion of the thoracic duct or any treatment of the fibroids, boils of the cervical area. And on the right side, it's measurement point for accessory duct. These all are the names of the lymphatic vessel. Accessory duct, this thoracic duct of the lymphatic vessels. Now LY11, where is it situated? LY11, it's almost the first rib, just near to the joint of clavicle and the first rib. There it is located. It's LY11 is the summation measurement point for lymphatic process in the following: autonomous nervous system, brain and spine related problem, pituitary, thymus, thyroid, parathyroid, then liver, gallbladder, pancreas, spleen, stomach, and this kidney also. Everything, any organs related, this is LY11 you can use. Then LY12, this is SNP for epigastric lymph glands together with the celiac lymphatic trunk. Related to the lymph of a spine, medulla oblongata, everything. Upper spine, medulla oblongata is the part of the brain again. Then kidney, spleen, pancreas, stomach, tonsils, etc. Anything in this structure. Okay. This is LY12. LY12 is, who will tell me LY12's location is corresponding with which meridians, which point? I will give you a clue. That is gallbladder meridian. Gallbladder meridians, which part? Which is the point which is corresponding to? Anybody in the chat box also? No, it's not GB18. You are very near to that. It's GB21. Okay, it's GB21. Now we will see next LY12. Now LY13. You can see the diagram is on the page number 31. 13, LY13 and LY14. These 2 points are mentioned there. This point is related to lymph process in bones of the nose to the skull bones. Nose and skull bones. All the skull bones and nose can be treated by this LY13. Gallbladder and extrahepatic bile duct, then the sympathetic nerve, it is a portion of the autonomous nervous system. It is given there. The spinal marrow, ethmoid cells, sphenoidal sinus, shoulder joint, upper extremity, hand, arm, upper arm, wrist, elbow. limb drainage of liver, facial node. Good point for the balancing the sinuses, and for anemia, treat this point. Even anemia is the indication of this point. LY30. Okay, it's on the back side. The sixth and seventh vertebra, cervical sixth and seventh, in between that. Just 1.5 lateral. It is LY13. Then LY14 is cervical 7 and thoracic 1. So which point do you know the urinary bladder points? Urinary bladder, which point is related? Sorry, actually my Wi-Fi connection was not proper. I have shifted to the data now. Okay, this is LY14. About the LY14 we were seeing. So spine and spinal marrow, this urogenital structure, pineal gland, adrenal gland. This is the best point to treat maxillary sinus and the frontal sinuses. Okay. Then in the spatial note, they have mentioned something like there are various lymph drainage points in the urinary bladder meridian also. See, this is LY3, 13 and LY14 are corresponding to the urinary bladder 11 and 12. It is mentioned. There is also one point relating to the lymph drainage of each organ in each of the concerned organs meridian. The lymph flowing from the liver account for about half the total volume of lymph in body. Okay, that's not our part. The drainage of lymphatic vessel of the liver part of the hepatic, celiac, pyloric lymph nodes, the right gastric, para-aortic lymph nodes, and diaphragm. Hence, treat liver lymph drainage point for accelerating the lymph supply to celiac, pylorus, diaphragm, etc. Okay, so this ends our lymphatic vessel meridian. It's very easy, and the commonly I will tell you the common used points are on the hands, almost up to LY, 4A and 4B. These are very important points. You can use that in a day-to-day life also to treat some common ailments. Okay, from LY1 up to LY4B. These are very commonly used points. On the hand, we can use the proper TCM points. This is lung meridian or 6 all meridians. So this is for the lymphatic drainage. If you will apply all the points in TCM meridians along with this lymphatic drainage meridian, any infection in your body related to that organ, particular organ, will be subside within a few hours also. Which is very much effective. We have used these points also by the applying the some pressure kind of thing or electro acupuncture directly putting the needle. But in Sansthan we are not using the needle. We are using the big magnets. It's beyond number 2 or 3 or 4. Okay, so this ends our lymphatic vessel meridian. Now we will go to the page number 32. This is nerve degeneration vessel. You might be knowing the first the meridian's location. Where is this meridian located? On the whether it is ulnar side or radial side. Now we have seen this lymphatic vessel meridian on the which side? Radial side of the thumb. Now this is on the index finger back side. Index finger Which side? You can see the diagram on 35 page number 35. It is ulnar side. Yeah, correct. Yes, Kiran madam. It's the ulnar side now. Okay. So we will see it's a description. This meridian is also called as the gray degeneration meridian and meningeus system meridian. It is related to nervous system now because the name itself suggests nerve degeneration vessel. Nerves, all the nerves in our body are related to central nervous system. So it is also called as a meningeus system meridian or gray degeneration meridian. So the gray matter is there. So location, this meridian starts from the outer side or the ulnar side of the index finger, runs back side of the palm. Okay, runs to the back side of the palm on this side. On this area. Okay. Now, how many points are there? Only 8 points are there on this meridian. Only 8. These are very useful. This is very useful meridian. It is useful in almost all the pain-related complaints. Wherever there are pains in the body, you can use this. This is a bilateral meridian on both the hands. Like. So specification, this is the second most important meridian discovered by Dr. Voll. This meridian represents nerve degeneration in the central nervous system, that is the brain and the spinal cord. Central nervous system, brain and spinal. This meridian is very useful in the treatment of the neurological problems of the whole body, including the brain and the 4 extremities. Because the extremities are nothing but the extensions of the brain. Okay, you might heard this. Treatment of cervical spondylitis, slip disc, sciatica pain, lumbar spondylitis, lumbago can be effectively done through this meridian. Treatment of the paralysis, paraplegia, polio, muscle spasticity, then progressive atrophy, sensation loss, intense pain can be also effectively treated with this. Then following the list of the forms of degeneration in the central nervous system, which can be treated via treatment of this nerve degeneration vessel. Which are they? Now they have mentioned almost 12 different types of the diseases. You might not know the names of these diseases, but you can, if you want to know all the signs and symptoms of these diseases, what are the complaints in the patients related to the disease, you can just Google it up. Even they have mentioned here in a very one-line or something. Gray degeneration. It is a degeneration of the white substance of the spinal cord in which it loses myelin. Myelin is the sheet on the nerve cells, nerves. Myelin and assumes a gray color. Okay. Then tabes dorsalis, wasting of the body muscular incoordination and intense pain sensation loss is there in this tabes dorsalis. These are the names according to the modern medicine. Names of the diseases, different complaints in the body. Anterior funicular of the spinal cord, hernia of the navel and spermatic cord. It is related to. Now, nerval sclerosis, muscle sclerosis, gliosis in the damaged area of the CNS when astrocytes increases, known as a gliosis. Brain tumor or spinal tumor, etc., can be treated with this. Then syringobulbia, cavity in the medulla oblongata. Then systematic atrophy, hereditary degenerative disorder. Then white malacia, tenderness in the white part, encephalomalacia, then softness in the brain and spinal cord. These are very modern medicine names actually, but we can use any complaint related to central nervous system and the nerves. Means any muscular, because nerves are the supply, means nerve supply is everywhere in the body, everywhere, every cell, every tissue of the body, every organ. Then red malacia, this replication of cerebral infarction, then brain tissue softening due to bacteria, there is abscess in brain tissue, destruction due to bleeding, apoplexy or apoplectic cyst, etc. Then there is one summation measurement point on this meridian, that is ND1A, is the summation measurement point. It's a very, very useful point in almost all the diseases, pain related. ND1A, whole autonomic nervous system of the body, brain and spinal cord. Then there are 3 control measurement points, CNP, on this meridian, that is ND1B, ND3A, and ND4. It is ND1B is a CMP for peripheral and central nervous system. ND3A is CMP for parasympathetic ganglia of the head, and ND4 is CMP for the cranial nerves. You might be knowing all the 12 cranial nerves. Do you know that all 12? Yeah, okay. So we will begin with the page number 34. Actual point is location and indication of these 8 points in this nerve degeneration list. Okay, it is ND1. This is MP for lumbar and sacral marrow. Okay, nerves related to the lower extremities. Treat this point for lumbar and sacral spinal degeneration. Nowadays, so many, everybody is generally having this spinal, this lumbar degeneration and sacral degeneration, or sacralization of lumbar 5 and lumbaralization of sacrum 1, like that. So it's the disc space is very less because of the degeneration according to the age. Degeneration happens according to the age actually. After 40 or 45 or in somebody 50, this happens. So generally these two main curvatures are there in our body. This is cervical C1 to C7, and these are the yeah, we will see the location actually. Location, we will come to that point. And the lumbar. This is the second spring in our body. So those patients who are long sitting, long standing, anything, the lumbar complaints arises in the body. So where is the actual location? Oh, just on the this outer side of this, on the ulnar side of this first index finger, just at the end part of this nail, just on the lateral aspect. This is just below the nail, or just corresponds to the nail line. In somebody, it corresponds to the below nail line, and there is a, you can see this is a concave part of the first digit. This is first metacarpal. Okay, this is a concave part. ND1 is located there. So treat this point for the lumbar and sacral degeneration. Then treat it along with the UB61. They have mentioned this. So if some diseases are there, you can of this lumbar and sacral spinal disc related problem or vertebral related problem, you can use UB61 point. Where it is location? Where is the location of UB60? Below on the leg, just one kun below UB60. Correct? UB60 is the center point of medial malleolus, the tip of the medial malleolus, lateral malleolus, and the tendo achilis. Tendo achilis at the back part of the leg. Correct? Backside part of the tendo achilis or Achilles tendon. Okay, am I audible? Okay. So they have mentioned a lot of points here, along with which point for spatial things, the spatial structure in the lower extremities, arteries of the leg, ST32, along with this ND1. Then the lymph vessel of the spine of lumbar 1, 4, and 5. Then LY12 along with this ND1. Like that, you can read it out. Different parts, different structures of the lower extremities. Then vessels of lower extremities, diaphragm of a pelvis, gonad, testicles, and ovary. The nerves, lower extremities, nerves, muscles, then veins, arteries, everything is given there. Along with which point of the main system, according to Dr. Oles. Use this ND1 point. Okay. Next page, we will go to the page number 36. ND1A. This is summation measurement point of for the entire autonomic nervous system, that is brain and spinal cord. Okay, ND1A. This is the second digit now. Means this is the second phalange, middle phalange. And it's a upper part, upper and lower part. This is ND1A and ND1B. You can see it's wonderfully given, indicated in the diagrams on the page number 35, the locations. It is a summation measurement point for the entire autonomic nervous system. Okay, diseases of the brain and spinal cord. Any disease in the brain and spinal cord, we have to use this ND1A. Also treat ST10A, SMP, or for parasympathetic nerves of the vagus nerve to treat GB20. It's a given different permutation and combinations. Along with these, we can use this ND1A. That you can use. In the nervous system of the body, voluntary nervous system is known as the parasympathetic nervous system. Autonomic nervous system is also the sympathetic nervous system. Okay. Now come to the ND1B. Where is that located? ND1B. It's a lower part. Correct. ND1B. It's a CMP again. CMP for nerve degeneration of peripheral and central nervous system. Both the systems. Now they have mentioned the 12 pairs of cranial nerves and 31 pairs of the spinal nerves. All nerves, any problem, we have to use this ND1B. In the next paragraph, they have mentioned this point is a control measurement point for the degeneration of legs, feet, and central nervous system. Any problem of all 12 cranial nerves, brain, spinal cord, treat this point for the sure. Now, ND1C. Where is that ND1C? The third is the interphalangeal joint in between second and third metacarpal. Second and third phalange. Below that. So ND1C. It's a measurement point for meninges surrounding the brain and the spinal cord. Okay, now one special thing I want to tell you here. If meningitis is there, any infection to brains. So in meningitis, if during attack, if somebody is having high grade fever, meningitis, because of meningitis, there is a high grade fever. So in meningitis also, too much shivering is there. Shivering along with fever. High grade fever, there are only three conditions. This is urinary tract infection. One is almost this meningitis, and high grade fever we have in this mosquito related some diseases. Maybe malaria, correct. In malaria and meningitis and urinary tract infection. These are the three diseases where high grade fever is present along with the shivering in the body. So in that, during this attack of that meningitis, we have to sedate this point. Okay, ND1B, we have to sedate ND1C, we have to sedate this point. And after the attack, we have to tonify. We have to tonify this point, ND1C. Okay, now we will come to the next point on page number 37, that is ND2. ND2. Okay, where is its location? ND2. It's located on the below part of this third phalange. Third carpal. ND2. This is a measurement point for cervical and thoracic spine. Okay, any problem related to cervical and thoracic spine. For thoracic spine degeneration, treat ND2 along with UB29, and for the cervical spine, ND2 along with SI6, because small intestine meridian is very much related to the cervical area of our all the cervical C1 to C7 vertebrae. Yeah, it is given. SI6 is the MP for nerves of upper extremities and cervical degeneration. To treat upper extremities, treat ND2 and SI6. Now they have mentioned the different points. Limb congestion of arms, LY6, then for veins, arteries, nerves of the upper extremities, musculature, bone system, everything is given. Now come to the ND3, nerve degeneration, ND3. Now this is in between both the finger metacarpals, second and third metacarpal, in between second and third metacarpal, upper side. Again, it's at the head, both the heads, ND3, ND4, and ND3 is at the center. Okay. Yeah, Kiran Ladha ma'am, can you show me plotting these 3 points on your hand? The locations of this ND3, ND3A, and ND4. Just mark on the hand. ND3, ND3A, and ND4. No, I am asking about ND3, ND3A, and ND4. These are not on fingers. These are not on fingers. Below that, in between first and second metacarpal. Correct. Very good. Excellent. Yeah, ma'am. Sudha, ma'am. Correct. Wonderful. That is the exact location of this ND3, ND3A, and ND4. No, ma'am. Pallavi, ma'am. You have used white marker, no? White. No. I think it's wrong. It's on this side. No. It's outer side of the index finger. Yeah, correct. In the first and second metacarpals. Yes. Okay. ND3. This is the measurement point for degeneration in brainstem, cerebrum, and encephalon. This is for the degeneration you can use. Now ND3A, CMP of parasympathetic ganglia of the head. Okay. Then ND4, the CMP of cranial nerves. Now ND4, the uses of ND4 is given on page number 38. You can see there. All the 12 cranial nerves are there. And along with ND4, how the treatment goes on. Nucleus in the brain of that particular nerve and the nerve treatment point. This extra, all the Dr. Voll's points of the proper 12 meridians. They have given olfactory nerve for brain, GB23-1, and in the nerve treatment point, UV2-1, like that. They have mentioned about all the 12 cranial nerves. Okay. We will see the last hypoglossal nerve, medulla. The nucleus in the brain is the medulla, urinary bladder 10, and in the nerve treatment point, ST5A. According to Dr. Voll's, we will see that detail in next treatise number 4. Every meridian, Dr. Voll's points. Now they have mentioned some note here. We'll see that. At the time of the treatment of paralysis, polio, epilepsy, and disorder of brain, give treatment on ND3, ND3A, and ND4. Any kind of patient of paralysis or any epilepsy disorder. Epilepsy is very common also. Not common, but so many patients nowadays are having this epileptic seizures type of kind of disease. Then even in polio patients, in any paralysis patient, you can use this all the 3 points. ND3, ND3A, and ND4. Treat the same side of the meridian as the side of clot in the brain. Correct? What does it mean? Treat the same side of the meridian as the side of clot in the brain. Suppose somebody is having paralysis of right hand and right leg, then where you will treat? Right or left? Right? No, no, no. See, I will tell you what he has mentioned. Treat the same side of the meridian as the side of clot in the brain. Suppose somebody's right hand and right leg is paralyzed. So clot must be on the left side of the brain. That's why his right side is paralyzed. No? The clot must be on the right side of the brain. That's why we have to treat these 3 points on the right hand. On the right hand. ND3, ND3A and ND4. These 3 points should be treated on the right hand of that patient. And if the patient is having left hand and left leg, means left side is paralyzed, then the clot must be on the right side of the brain. That's why this left side get affected, na? Because the neurons are opposite in the side. Na? UMN and LMN, lower motor disorders neuron and upper motor neuron. And the second note they have mentioned, treat the affected side of the cranial nerve. In the case of cranial nerve, you have to treat the affected side. If it is on the left side, then treat the left side. It is on the right side symptom, treat the right side. Suppose somebody is having facial palsy, facial paralysis of right side. Suppose a right cheek or right side facial palsy is there. Then which side of the meridian of this ND we have to treat? Right only, because it's upper motor disorder. So in the case of cranial nerves, treat the affected side of the cranial nerve. So if facial paralysis, in case of facial paralysis, if right facial pulse is there, treat these 3 points of ND meridian on the right side. If left side facial pulse is there, treat these 3 points on the left hand, left meridian. Okay. That is given there. Then the third, fourth, fifth point is the same related to that only. Then 6th point is in the paralysis of limbs of one side, the opposite side of the brain gets affected. See, it's given in the 6th point. Hence, the treatment of the paralysis treat the opposite side of the brain. Correct? In facial paralysis, treat the same side of the brain. In flaccid syndromes, main treatment should be given on the spinal cord. Okay. So this ends our 5th chapter. Okay, ND, this nerve degeneration vessel. Have you understood this properly, or any difficulties there? You can ask in the group also on Wednesday. Okay, so now we will see this next meridian, 6th chapter on page number 40, allergy or vascular degeneration vessel. Allergy meridian, AD meridian. This allergy meridian is also known as the vascular meridian or tissue degeneration meridian. Okay, because allergies are generally affected on the vessels. So vascular degeneration or tissue degeneration. Location, you can see the location. It's the ulnar side of the middle finger. You can see it's a diagram is on the page number 48. Ulnar side of the middle finger. Correct? Now we will see its number of points are only 5 points are there. Then specification, this meridian treats all types of allergies. Skin allergies, allergic colitis, allergic gastropy, arteriosclerosis, allergic asthma, allergic sinuses, allergic hay fever, rhinitis, allergic due to dental problem. Any type of allergy in the body can be treated with the help of this meridian. AD meridian. Allergy or vascular degeneration. It cures the causes of the allergy. Then Dr. Voll proved that arteriosclerosis and it's a resultant disease of the heart also of allergy. Okay, so it stops the increase the blockage in arteries of the heart and blockage reduces it's also gradual. Okay, what is allergy? You must be knowing this. What is allergy? Allergy is the abnormal reactivity of the body's immunological system. Allergy causes vascular degeneration specifically. What are the causes of the allergies? Nutritive allergies. Generally in our day-to-day practice, we are seeing some environmental pollen allergies, environmental changes, or some nutritive. Whatever eaten, we are allergic to some, or sometimes allergic to some allopathic drugs, chemicals like that. Nutritive allergies caused by excess consumption of strawberries, pineapples, tomatoes, nuts, fish, fats like milk and eggs, etc. Bakery products and dairy products. Okay, some citrus fruits are causing the allergies. Then rice, grain, potatoes, vegetables, fruit juice, fruits, everything, any foodstuffs where the preservative is added. Because on vegetables and fruits, farmers have generally these insecticides and herbicides are applied on that. That's why allergies are happening. Nowadays, we have seen a lot of allergies of those patients who are eating grapes, specifically grapes, without washing the grapes. Then suddenly these allergy type of ailments come. Cause of head allergies are given. Head allergies are because of the hair dyes, shampoos, cosmetics, hair lotions, crayon, mascara, everything. Nail varnish, face cream, dental materials, dental fillings, amalgam, aftershave lotions, then acrylate, plastic, polyester, everything. Then causes of allergies of oral cavity, then dental materials and intramuscular medicaments if given. Then allergies are often caused by pig meat, egg, fish, meat extract, milk, fertilizer, pollen dust, asthma specifically, insecticides, washing powder, detergent. So many ladies have come with the allergies of detergents and soaps to the hands. Different skin ailments are there, allergic to these chemicals used in the soaps and detergents. What are acquired allergies? Then allergies which are not inherited but are contracted as a result of factors acting from the originating from outside organism called the acquired allergies. Acquired allergies are often preceded by impairment of liver. Hence, treatment of the liver 3-point is very used in the allergies. Along with this meridian, AD meridian. Types of allergies. Allergies may be of 3 types: antibody-mediated allergies, cell-mediated allergies, and mixed antibody and cell-mediated allergies. Antibody-mediated allergies, they have mentioned, cause immediately within minutes of exposure to an allergen. Correct? You might have this experience because so many from us are having this experience. Exposure to sunlight even makes skin irritation or skin rashes. This is an acute type of allergy. Then this type of allergy reaction include food allergies, childhood enzymes, hay fever, etc., etc. In August and September, generally the weeds are having this allergy. Following are the effects of above allergies. Allergic reaction causes vasodilation leading to skin rashes. In every allergy, there is a vasodilation leading to skin rashes because it's the first reaction of our body, of our immune response. Okay, then various types of allergy, smooth muscle contraction, edema, swelling happens. Sometimes it's given there. Okay, you can read it out. Then cell-mediated reactions. These allergies reactions appear over a period of 24 to 48 hours. For example, intracellular microbes may cause tuberculosis, measles, mumps, etc., smallpox vaccines. Some metals and chemicals combine with the protein of the skin and may cause allergic contact dermatitis. Contact dermatitis. This is the one skin disorder. Okay, and on page number 43, we are reading the third type of mixed allergic reactions. The destruction of the body's own cells causes mixed allergic reactions. Self-antigen in thyroid causes Hashimoto's disease. In self-antigen in stomach causes Addison's pernicious anemia. Self-antigen in cortex and adrenal gland causes Addison's disease. Self-antigen in a pancreas causes type 1 diabetes. And self-antigen in joints with the sinus membrane causes rheumatoid arthritis. These are the autoimmune diseases. This is our own body's autoimmune response. So these diseases are nothing but the allergic kind of diseases. That is mixed type of allergy. Now hay fever on page number 44. Main symptoms are rhinorrhea, redness of the eyes, and excessive secretion of the tear. You have to know in any allergy, excessive secretion from the nose, excessive secretion from the tear means ear, eyes, and this tears flowing, and the skin rashes. These are the very common ailments, common symptoms of any type of allergy. Causes of the hay fever, pollen, mites, and animal danders like that. These substances cause vasodilation. The same thing again. Increase the permeability of the capillary walls, hypersecretion of the glands, and swelling of the tissue. That happens in every allergy, na? Because it's a response of our body. Now, allergic asthma or atopic asthma or extrinsic asthma. These are the type of different asthmas caused due to allergens. Now come to the page number 45. Allergic alveolitis. It's one type of a lung disorder. Alveolitis. It's inflammation of alveoli because of the allergens. The general population is, which is the targeted population in this type? Farmers' lung bagosis. Because farmers are more prone to this type of bird handlers and malt workers. Okay. Which are the symptoms? Alveolar walls become thick. There is a progressive fibrosis. It leads to pulmonary hypertension and right side of heart failure sometimes. And in rheumatic arthritis, they have given some pathological changes. The pericardium may become elastic. The function of the expansion of a heart may be reduced. Like that. Because the elasticity decreases, and the structures of that coverings or particular organs becomes fibrosis. Fibrosis happens due to these allergies. Okay, so we will see the point-wise locations and indications. The AD1 point, first point, AD1, 47 number page. This is MP for allergies of the lower part of the body. You have to remember, any first point is indicates the last, means the lower part of the body. The middle point is the middle, and the third point indicates almost the upper part of the body. This is the general features we have seen. Allergy of the skin of the lower extremity, allergy of the skin of the abdominal organs, allergy of the skin of the minor pelvis, then allergy of the skin of the lower portion of the back, allergy of the vessels of the lower part of the body. So all lower extremities use AD1. Okay, AD1A, MP for allergic irritation of the autonomic nervous system. Then AD1B, you can see the locations in the next page, 48 page number. Very, very simple to locate these points. AD1, AD1B, CMP for allergy process throughout the body. Anywhere in the body, anywhere allergies happen, just use this point. It is the CMP. AD1B. Okay, where it is located, AD1B, it's almost lower part of the second phalanx, middle phalanx. Now AD1C, SMP for arterial or vascular sclerosis. Vascular sclerosis, it is specific use. Then special notes to treat arterial sclerosis, first treat this allergy. Then initial damage to internal lining of a blood vessel is called as arterial sclerosis. Arterial sclerosis and blockage of the arteries is the last stage. So use this AD1B. It's a CMP. Then AD2. Okay. AD1C. It's a SMP. And then AD2. MP allergies of the upper portion of the body. AD2 is used for upper portion of the body. Allergy of the chest and throat, skin and chest, upper portion of the back, neck, upper extremities, etc. This points to its allergy of the respiratory organs, asthma. Then skin allergies of the upper body, allergic myocarditis, skin allergy of the neck and the nape of the neck. Then skin allergy of the upper extremity, everything, upper extremity. Okay. Special note in the next page number 50, you can see special note. Treat AD2, ALU11, ALU10D for allergic asthma. If somebody is having allergic asthma, use these 4 points. 3 points. AD2, ALU11 according to Dr. Voll, and ALU10D according to Dr. Voll. We will be seeing these points in the next treatise 4. Then the next last point, AD3. Okay. It is on the metacarpal, upper head of the metacarpal, third metacarpal bone. AD3. Allergies of the head. AD3 is used for allergies of the head. It includes the allergy of the skin of the head, organ of the head, then nasal cavity, allergy of the paranasal sinuses, face and the skull, hair, dental problems, everything. specific given, migraine, rhinitis, eyes, oral cavities, any allergies upper on the head and sense organs. Okay, and in acquired allergies are the most of the time preceded by impairment of the liver. Hence, treat liver also in causes of allergy, specifically treat liver 3. Okay, liver 3 point, you must be knowing its position on the first and second toe in between that. 1.5 kun from the liver 2 below. It's a liver 3 point. Okay, so in allergy, this is very important meridian, AD, allergy or vascular degeneration meridian. We have seen 3, lymph vessel, ND, nerve degeneration vessel, and allergies, this AD meridian. Okay, so in tomorrow's class, we will be seeing this next, is the 7th chapter, organ degeneration vessel. Okay, and parenchymal epithelial degeneration. Okay, so today's syllabus is almost covered. Tomorrow we will be seeing the next chapter, 7th onwards. How much we will try to cover almost this syllabus of this treatise. So it's almost 5 o'clock and 2 minutes over. Okay, bye bye. All of you, we will meet tomorrow. If any difficulty, tomorrow you can ask, or day after tomorrow in the Wednesday's class, 11 to 1. Okay, thank you very much.